Hello, this is Dr. Nony, board certified internal medicine physician with ER experience. Today we will have another exciting and interesting story from wild rural medicine practice. Here we go. He walked into the ER holding his hand. No blood, no cut, but he said, "Doc, something shot into my finger. I know it." We didn't see anything at first. No open wound, no injury, no cut, just pain. Most doctors might have sent him home, but something didn't sit right. We got an x-ray, and what we found buried in his finger has changed everything. This guy walks into the ER, mid-40s, looks healthy, works on cars as a hobby. Earlier that day, he was using a high-pressure power washer to clean parts under the hood. He was even wearing gloves, not the cheap kind of gloves, thick utility gloves. Then suddenly, a pop. He feels a sharp pain in his index finger, almost like a bee sting, but deeper and more sudden. He checks his glove, nothing torn. Looks at his finger, no wound, no bleeding, but the pain, throbbing deep, won't go away. So he drives himself to the ER to check it out. Now, here's where it gets tricky. When he gets to us, the finger looks mostly normal. Maybe a bit swollen, but no break in the skin, no bruising, just this weird pain. He tells me, "I swear, something shot into my finger and I feel it." And I believed him. So we did what any careful doc would do. We ordered an x-ray. And boom, there it was, a foreign body. About 2 centimeters long, 1 centimeter wide, buried deep in the tissue. Could have been a metal shaving, could have been a fragment of plastic. But either way, this thing was hiding and it needed to come out. Let's break this down. High pressure injection injuries. They can be deceptively quiet. The pressure from a power washer, paint, gun, or grease line can inject particles under the skin at crazy speeds. We are talking over 2000 psi. And the result? Deep-seated trauma with barely any external sign. What makes these so dangerous is the delay in symptoms. The initial pain may be tolerable, but deep inside there is tissue disruption. There is a risk of infection and possibly chemical irritation depending what got inside. These injuries are known to cause necrosis, compartment syndrome, loss of limb if left untreated. Now, what about the treatment? Why not just stitch the finger up afterwards? Well, because that foreign object introduced bacteria into the soft tissue, closing the skin traps it inside. That's a setup for disaster. So we let it heal by secondary intention, which means leaving it open so it can drain and heal safely. Then the turn comes to giving antibiotics and tetanus shot. We prescribed oral antibiotics to prevent infection, and because the wound was considered dirty, we gave him a tetanus booster, even though he had had one within 10 years. Because when it comes to tetanus, we don't play around. Now, we move to the next step, which is going to the procedure room. We prep the hand, sterilize, inject local anesthesia. Then we bring into fluoroscopy. Think of it as a live action x-ray. It lets us track the object in real time while we explore, cut and remove it safely. Under fluoroscopy, we located a jagged fragment, maybe metal, maybe hard plastic, buried near the tendon. We make a small incision carefully, dissecting down layer by layer, until finally we find it. A greasy, sharp-edged piece, definitely not something you want living in your hand. We remove it cleanly, irrigate the wound thoroughly, and again leave it open for drainage. He comes back the next day for a follow-up, and the difference, night and day. Swelling down, pain significantly improved, no redness, no sign of infection. He told me, "I'm glad I came in. I almost didn't." And honestly, that decision might have saved his finger. Here's what this case taught me and should teach all of us. Number one, gloves help, but they are not armors. High pressure tools can inject debris right through. Number two, if you feel sudden pain or deep pain with no clear wound, trust your gut. It could be a hidden foreign body. Number three, almost get an x-ray. If the pain is weird or doesn't match the physical exam, don't guess, get imaging. Number four, not all wounds should be closed. In contaminated injuries, open healing is often safer. Number five, early care equals few complications. This guy came in the same day. Had he waited, we could have been dealing with a major infection or even surgery. Sometimes it's not the obvious injuries that can cause the most damage. It's the hidden ones. The ones that don't bleed, don't bruise, don't scream. This guy listened to his body, and because of that, we caught it early. These are the real cases I see. Real medicine, real patients, real outcomes. This is Dr. Nony's Power Lab, where we break down the why behind the science of medicine, so you can learn from what actually happens. Hit that like button, drop a comment if you have seen something like this, and please subscribe for more real cases that could save a life, maybe even yours. Until next time, stay safe, stay sharp, and trust your gut. Thank you and have a great day. Bye bye.